The role of a hospital social worker includes discharge planning. Discharge planning is anticipating your patient's care needs and coordinating their care for their recovery before they discharge from the hospital. In this video, I'll give a brief overview of the most common discharge plans hospital social workers often coordinate. Hi, my name is Tabby, and I'm an LCSW with over 13 years of social work experience in the healthcare field. And I'm here to bridge the gap between what you learn in social work school and real-world experience. So I made a video on biopsychosocial assessments specifically for hospital social workers. If you haven't seen that video, I would highly recommend that you check that out. And in order to coordinate care for a successful recovery for our patients, we need to understand the different levels of care and the most common discharge plans to be able to coordinate that care. This is a handout that I like to use to give my patients and families to help them visualize the different levels of care. I like to describe the levels of care as stairs. So at the beginning of the stairs, at the bottom there, is going to be the acute care hospital. That's the normal, regular hospital, the hospital that you go to for an emergency, the hospital that you go to for a surgery or for a severe illness. That's what an acute care hospital is. Now, it's important to know that an acute care hospital is meant to stabilize a patient. It is meant to be short-term. It is not a long-term care coordination. It's not a long-term care facility. A lot of patients and families get that a little confused on that, and they expect that they get the surgery done or the procedure done, and then they can stay there until they are ready to go home. But that's not what a hospital is designed for. So a hospital is supposed to be to meet the immediate care needs, the urgent care needs of the patient, and get them to the point where they're stable enough to start the next level of care for their recovery. For most hospitals, the preferred average length of stay for a patient would be 3 to 4 days. Now, obviously that doesn't happen all of the time, but that would be the ideal situation. There are obviously situations where they're going to end up there longer for complications, or for maybe they just need a longer period of time of stabilization. But it's really just about getting that patient stable so that they can get on to the next level of recovery. The next level of care would be a long-term acute care hospital, also known as an LTAC. A long-term acute care hospital is an extended inpatient hospital for patients who are too medically complex to go on to rehab or to go home. These patients need a longer period of time to stabilize in order to really focus on rehabilitation so that they can get back to their prior level of function. These patients might require specialized wound care. They might require specialized equipment that you're not able to get in the home or that a skilled nursing facility is unable to obtain. They might require IV infusions that are on a regular basis, like more than once a day needing the infusion. They might need TPN or PPN, which is going to be your IV nutrition. They might need dialysis, where they need to be inpatient while they're receiving the dialysis treatment, along with a whole bunch of other complex needs that they might have. Like I said, an LTAC is considered an inpatient hospital. Now, these patients, their main goal is to get to the point where they can focus on rehabilitation. So although these LTACs do offer physical therapy, occupational therapy, speech therapy, that's not going to be the main focus. It's just going to help them to continue to maintain stability until they can really start focusing on that rehab. The average length of stay for an LTAC is typically about 25 days. Of course, that's going to vary, so it's going to be either less or maybe a little bit more, depending on their complex needs, but also depending on health insurance. After a patient is medically stable and can start focusing on rehab, one of their options might be to go to an acute rehab hospital. So an acute rehab hospital is an intensive inpatient rehab facility. These rehab facilities require a patient to be able to participate in at least 3 hours of therapy every day. Now, this is split up throughout the day, and it can be split up between multiple disciplines like physical therapy, occupational therapy, and speech therapy. But the patient has to be able to withstand those 3 hours a day. The average length of stay at an acute rehab hospital is typically between 1 and 2 weeks. However, this is also dependent on how much gain the patient is making, how much progress they're having, and it also depends on their health insurance plan. The thing with acute rehab hospitals is also, in order to qualify for this level of care, not only do you have to be able to meet those 3 hours, but it also depends on what your health insurance will allow. So some health insurances, like a Medicare Advantage plan, typically are not going to pay for an acute rehab setting. They would prefer that the patient go to a skilled nursing facility, even if they can meet those requirements. Some of those Advantage plans, such as Humana, might require them to have a copay. That copay can be pretty hefty. That copay can be between $250 to $350 a day. So sending someone to an acute rehab hospital, there are different factors that you have to take into consideration and explain to your patient before coordinating that care. If a patient doesn't qualify for acute rehab, or their insurance isn't going to pay for it, usually the next level of care is going to be a skilled nursing facility, also known as a SNF. So a skilled nursing facility, or a SNF, is a less intensive rehab option. These are facilities that I would say majority of my patients are sent to, but it also depends. Now, a skilled nursing facility, they're going to be providing 24/7 nursing care and can provide skilled needs such as wound care. Some of them are able to do infusions, not very often, but some of them are able to. This is going to also include medication management. They're going to be able to make sure that the patient is safe. There's a lot of nursing needs that they can do as long as it's not too complex. This also includes rehab services. So you're going to have physical therapy, occupational therapy, and speech therapy. Now, because this is less intensive, you're really looking at about 45 up to 45 minutes a day per discipline. So a patient might be able to do between 15 minutes to 45 minutes of physical therapy that day, and then later do it with occupational therapy, and then later with speech therapy if needed. But it's going to be going at the patient's pace. So if a patient is going to take a little bit longer, or they just need a little bit more time to participate in those therapies, or maybe they just need to do it at a little bit slower pace for them, then the skilled nursing facility setting is perfect for them because they can work with that patient. Now, a skilled nursing facility's average length of stay is typically, I would say, between 3 to 6 weeks, but it also depends on health insurance, what they're willing to pay for and authorize. For Medicare patients, especially traditional Medicare patients, on average, patients probably stay there about 21 days or 20 days, because Medicare will pay for up to 20 days at a 100% depending on their needs and per episode. But I will go into more details about health insurance in a later video. The next level of care would be home health care. So these patients are discharging home, but they still have a little bit of skilled needs. These patients might require a nurse to come in to help with medication management, for safety, for education, sometimes for very non-complex wounds as well at home. And they also provide therapy at home. It's a lot less intensive than going to a skilled nursing facility or an acute rehab hospital, of course, but it helps get that patient to a point where they can maneuver in their home in a safe way and get them to the point where they're at their prior level of functioning. The biggest thing with home health care is that patients don't understand is it is not 24/7 care. Home health care is not 24/7 care. Home health care is just to aid you in your recovery at home. Home health care is going to provide a registered nurse, an RN, that usually comes in, I would say, about 1 to 2 days a week, depending on their needs. That's going to include help with medication management, maybe educating the patient on their medications and how to take them. It's going to include safety checks. It's going to include just any kind of education and just making sure that the patient is safe and that their skilled needs are met. Home healthcare also provides physical therapy, occupational therapy, and sometimes speech therapy. Now, these therapies are going to come into the home, they're going to evaluate the home situation and recommend certain equipment to help the patient be successful in their recovery at home. They also may do work with the patient on maneuvering around their home, and they're just working with them on exercises to get them to the point where they can do those exercises on their own at home. They're usually going to come in maybe once or twice a week for maybe up to 45 minutes or an hour at a time. Not a lot. Again, it's not 24/7 care. Some home health agencies are able to provide a home health aide. Now, this home health aide usually is there to help with bathing. So if a patient is needing a little bit more help or assistance with their bathing needs, this home health need might be able to come in once or twice a week to help them with this need until they are at their prior level of functioning and can do things on their own, or until a family member can do it for them. But again, it's only 1 to 2 days a week, and not all home health agencies are going to offer this. The other thing with home health is a patient has to be housebound. So that means that they can't leave their house on their own. They have to be able to be accompanied by someone. So for example, if they're just not able to go out and drive, if they're not able to go to the grocery store or to church or anything like that, they have to have someone with them. That's going to be housebound status. Sometimes patients can leave the house on their own for things like, things like church, for going to haircut, grocery shopping, but they're very short trips. But typically, homebound or housebound means that you need someone to take you, that you can't do it on your own. So that's the thing with that. Medicare does pay for home health, and there's usually not any prior authorization. But depending on your health insurance program, there's going to be certain home health agencies that are in network. So you'll have to take a look at that. Again, I'll kind of address this at a later video about health insurance. So those are the main, I would say, levels of care. Other discharge plans that you may coordinate as a hospital social worker are going to be sending them to a long-term care facility like a nursing home, maybe getting them set up for assisted living or independent living, so arranging that care as well. Or also setting up hospice and palliative care, hospice and or palliative care. I will probably go a little bit more into depth about hospice versus palliative care, and then I'll make a video also on the different levels of long-term care. So nursing home care, assisted living, independent living, and what the differences are. So keep an eye out for those videos. These are going to be the main discharge plans that you're going to coordinate as a hospital social worker. It's important to know that if you are a social worker in any of these settings, like a skilled nursing facility, acute rehab hospital, an LTAC, you're more than likely going to be doing similar discharge plans. So if you work in any of those settings, this is going to be helpful for you as well. I hope this content was helpful. Please look out for future videos where I'll go more into depth about different discharge plans. And it's going to be really helpful if you can give me any sort of feedback. So if you really liked this video, or if you have ideas of what I could do different, please leave a comment. It's going to help me out a lot in terms of feedback and making better content for you. And also, please like and subscribe to this video if this was helpful. And don't forget, I do have a social work mastery newsletter that you can sign up for additional tips, tricks, and resources on how to become a more efficient medical social worker. Thanks guys so much for watching, and I'll see you next time.